children do communicate through their play, and that the play is their language and the toys are their words. And so it's our job to kind of, try to step into their world and understand. I think the most powerful part is just the opportunity for them to feel free and to feel like they have some control and empowerment. It's hard for adults to come and sit in therapy across from a stranger and talk about the deepest, darkest things that maybe you're thinking or feeling that you have experienced in the world.
Hey guys, I'm back with another episode of Mental Wealth. This podcast is used to express thoughts, experiences, and lessons. I aim to be as transparent as possible. If you enjoy an episode, please don't forget to like, comment, and tell a friend. Thank you. Hey everybody, welcome back to Mental Wealth. In today's episode, we have a new special guest. This is Dr. Jennifer Hall. She is a licensed professional counselor, a registered play therapist. She's currently a clinical professor at Clemson University. She has a past history of being a special education teacher and a school counselor. And she is also the South Carolina Association for Play Therapy resident. How are you doing, Dr. Hall?
Great. Thank you for having me. I'm really excited to talk about this subject today.
Yes, ma'am. I appreciate you for coming onto the podcast. I just want to tell you thank you for the workshop that we had. It completely opened my eyes and has changed the way that I do all my therapy sessions with my kids. When you were talking about play therapy, it made me realize that kids can communicate back to you in a lot of different ways, and play therapy being one. How would you define play therapy or child-centered play therapy?
Yeah, so I'm trained in child-centered play therapy, and I know the Association for Play Therapy, which is the International Association, has their own definition. But in my mind, child-centered play therapy really embodies this idea or notion that children do communicate through their play, and that the play is their language and the toys are their words. And so it's our job to kind of try to step into their world and understand and kind of encompass these ideas that Dr. Gary Landreth had put forth when he developed child-centered play therapy or built upon it, which are, I see you, I hear you, I understand, and I delight in you. And those are kind of the things that we want to convey to children when we're utilizing play therapy with them and just trying to peer into what it's like from their perspective in their world.
Yes, ma'am. Who's the ideal play therapy client?
The ideal play therapy client. Wow. Well, research behind play therapy has really shown effectiveness in all different types of issues that are presenting or diagnoses. So you have children with what are called externalizing behaviors, which might be like maybe they're hitting or yelling, or sometimes, you might see what's called tantruming, those kind of things, aggression, aggressive type interactions with other peers or even adults. And then also there's some internalizing issues that might be happening where we think of like self-esteem or depression or anxiety and things like that that might not be as readily available or seen in a child, but may show up in different ways. And so really play therapy has proven to be effective in research through all these types of issues. Children that have experienced what we call, like little traumas in their life or big traumas, which could be things like abuse, neglect, bullying, if they come from other times of trauma or, broken homes or all kinds of issues that children might deal with. So play therapy really can be utilized with lots of different children in lots of different ways and in all settings too. It's done in schools, in therapy settings, in private practices, hospitals. I used to work at a domestic violence shelter there, so I did lots of trauma work and play therapy with kids there. And really, it can be used all through adults too.
How does the fear of domestic violence dealing with children manifest in their nonverbal play?
Okay, so you're wondering kind of like what that shows up like? Yeah. So really it is individual for each child. Of course, there are some trauma impacts or symptomology that you might witness because there are like neurological things that actually trauma like rewires the brain a little bit. So you might actually see some regressive play or regressive things. Like we used to have students that were like children in like third or fourth grade, and they'd be wetting the bed, and their mom or dad wouldn't know what was going on, but it was really that regression in the brain to the trauma impacts. But it can show up in lots of different ways. Sometimes they are more aggressive with others. They kind of like what you would call it, flip their lid a little easier because They just kind of like something triggers that trauma response in them. And so it could be like a fight, flight, or freeze response. And so you might notice that in children where you're wondering, like, well, I didn't really do anything. Why are they flying off the handle at me? It might be that like fight response coming in, or they might just like recoil back, and that could be like, the flight or fawn response that's happening. So you might see that. You might see some academic impacts depending on the age of the child, because the part of their brain that's used for learning and understanding is impacted by trauma. And so it's not as online as a typical brain might be that hasn't had that experience. You'll see some, somatic things like stomach aches, headaches. You might notice if you work in a school that the child might be absent a lot or
Uh,
tired. So it's really good to touch base with like the school nurse, because sometimes they'll have some kids they'll see frequently for those kind of things, and it might lead to other conversations. I remember one time when I was a school counselor, there was a student, I think he was in second grade at the time, and the nurse had told me, like, you might want to check on him. He's kind of been a frequent flyer. He's coming down every day, and I've been giving him a peppermint for a stomach ache, but there's really nothing that I can tell medically wrong with him. So I did check in with him, and come to find out there was some domestic violence going on at his home. And he
mm,
was up at night with his sister worrying. And while he was at school, he was worrying about mom at home and what was happening to her. So, yourself, if you're anxious or worried, that can kind of tie your stomach in knots a little. So the saying goes. So that was kind of what was going on with him.
how does play therapy help these children process these stressful events safely?
Yeah, yeah. So there's lots of different ways. Play in general just is a multisensory experience. So it really engages all those parts of your brain that I mentioned that are impacted by trauma. So that emotional limbic area of the brain, that prefrontal cortex, like learning thinking part of the brain, it really integrates all of those pieces when children are playing. So it does that like neurological part. But it also, going back to that idea that children communicate and understand the world through play, it's kind of like if you think back to watching or even playing yourself when you would come home from school or in the summertime, like a lot of things
Mm,
you would play might mimic what was happening in your life, like school or home or with friends or you
yeah.
know, TV shows or whatever you're watching. So similarly, if they're experiencing these things around them, it's kind of their way to make sense of it. And during play therapy, they might actually play out some of the things that are happening in their world. And so the play therapist is there to help reflect feeling and meaning and provide some understanding and naming some of the things that they may have been experiencing.
Yes, ma'am. How does play therapy affect children with learning disabilities?
So play therapy can be used, like I said, with all types of students. I actually completed my dissertation work with third graders that had learning disabilities. And what I was doing with play therapy was just trying to see how it might impact their academics, their social, emotional, self-concept, and kind of those social skills in my study. And so what I noticed is that really the teachers noticed that the students felt more confident to like engage with the other students. So they would come back, let's say, from their special ed pull out time, and maybe the class was involved in some like group activity, or they were discussing some concept. And before that, the students kind of sat there, was kind of back in the background.
Yeah.
But after coming to play therapy, they noticed that they were more eager to like get involved in the conversations or raise their hand or ask questions. And so I thought that was really interesting that some of that confidence or self-esteem was kind of built up more with them. There's been also lots of other studies, students with like autism and other delays that, it's been successful in helping them through some of those communication and social skills and behavioral things.
Did you notice anything with the children dealing with being frustrated during play with the other kids? Because I could only imagine if a child has a history of struggling to communicate, especially with a learning disability. Um,
hmm Yeah, so the play therapy I did with the students was individualized, but they definitely are able to put words more to their feelings and emotions outside of the playroom. So
okay.
oftentimes teachers or parents will comment like, yeah, they're not, being behaviorally aggressive. They're really using their words and saying, I'm really angry about that. Really able to put a word to their feelings. And so therefore that kind of reduces those behaviors. And so yeah, when they're engaging with peers, that similarly happens where they're not just going to like punch Joey because they took something. They're going to say, hey, I'm really upset you took that. That's not, that's mine. So they might start to use their words a little bit more because we're helping name the things that they're experiencing and giving them some words to put with that experience.
I've noticed, especially with that, because I know it's kind of a problem in my county where we don't have enough special ed teachers or enough special ed aides. So when we deal with the more complex kids who could possibly become aggressive, I notice it tends to escalate faster. And I'm thinking that's possibly because they don't have as many interventions to use or being able to truly express themselves.
Yeah, that definitely could be part of it. They don't have those words or the understanding of, how to communicate that, which we see often in developmental levels that are younger. If you think to like toddlers, how when they have big emotions, how they display that, right? Similarly, kids with some maybe mental health delays or mental delays, they might do the same thing.
How does play therapy help children navigate complex grief, attachment issues, and boundary problems dealing with foster care or adoption?
That's a lot, a lot to unpack there. Yeah, so, well, I would say that in the playroom, play therapy does help to kind of promote empathy and engagement with others. And so there's that piece because we're providing the safe, secure, predictable environment for the children to come into. And a lot of times, if they've experienced some traumatic experiences like traumatic grief or traumatic loss due to adoption or environments like that, there might not have been some consistency or predictability in those circumstances. So the play therapy room in the child-centered way, we're always the same way every time. We use the same kind of basic skills. We always have the playroom set up the same way every time. We always end and begin the play session the same way every time. So it really helps to reduce that anxiety piece. And then when they know that like we're conveying these ideas of I see you, I hear you, I accept you, and I delight in you, that's going to have that reciprocal relationship and begin to kind of maybe heal from some of that uncertainty. And then we also at the same time often, when we work with kids, we work also with a lot of other adults in their lives. So at the same time, we're working with the parents or caregivers or adoptive parents on some of these same skills that we are doing in the playroom so that they can kind of reinforce some of that at home. So for example, the reflecting feelings, the esteem building, we also return responsibility, and we also do limit setting in a supportive way that's not really shaming, but also it's helping to acknowledge their feelings, just simply stating a limit and then targeting an alternative, more acceptable way to release their feelings. So we're teaching parents these skills too, and also encouraging them to have some special playtime with their child that's child-led in a safe space where they can kind of start to build relationship and attunement and understanding with their child.
Yeah, that's amazing. Referencing the limit setting, can you break down a therapeutic approach to setting boundaries in the playroom?
Yeah, sure. So we don't have limits that are like written out or rules in advance because we want the child to feel free and empowered and autonomous in the playroom. But we do make a statement of, at the beginning of each play session, this is your playroom, and in here you can play with these things in most of the ways you'd like to. So it implies that there are some limits to what they can do, but we really only introduce limits as they come up. So for example, if there's something that they might want to engage in dangerous play or destructive play, or something like that, that's when we would incorporate the limit in the playroom. But otherwise, we allow them a lot of freedom to, express themselves in the playroom that maybe they're not as used to in other environments. So, for example, if they were going to purposely break something out of anger, we would use what's called the ACT limit setting model. So A stands for acknowledge the feeling, C is communicate the limit, and T is target the alternative.
Okay.
So you could say like, oh, I see you're angry, but that's not for breaking. You can punch the pillow instead if you'd like to. Or you can say you can punch the pillow or the couch instead. And so that's kind of, not putting any, negativity on the child, like stop that or don't, or that's bad, or, so they're not internalizing that negativity, but just it helps them to, acknowledge what's happening with them. And sometimes that can help kind of bring it down a level where they're
Yeah.
okay, I'm seeing you understand, you can see that I'm upset. And sometimes that'll extinguish it enough, but if not, we kind of go forward with the limit and then giving them something alternative because, if they're their brain is off, flipping their lid or they're out of control at that moment, it's going to be hard for them to kind of think about what's an appropriate alternative. And maybe they don't even know. So it's just kind of helpful for us to direct them in that way. So we do that in the playroom. We also teach parents and teachers about using those skills too.
Yes, ma'am. I like how you said that because it's hard for children. You can say what they're doing. Like, let's say if a kid throws a cup and you say that's bad, it's hard for the child to not understand that they're not saying I'm bad. They're saying the action that I'm doing is bad.
Yeah, exactly.
Yeah.
And sometimes they don't know what else to do. And by us saying don't do that, we're not telling them what they can do.
Ah, that's great. I never thought about it like that. How can parents effectively apply these same limit setting approach in the home?
Yeah, so it is a kind of a different way of speaking and thinking about it. So it does take some practice and just trying to think of words that you would use as alternatives, for example, or making sure you have items that can be ripped or broken to, get the experience out. So for example, in my playroom, I have like popsicle sticks, I have like bubble wrap, old paper, toilet paper rolls, things like that, that if they do feel that anger inside that they need to release by breaking something, there's something acceptable that they can break and rip. So, get your old junk mail out and let the kid, let your child rip
Yeah.
that up or something. You could do that. So I would say have that, but also just try to practice and think about what you would say. Because in the moment, it's sometimes hard to come up with the ACT method. And maybe you need to write yourself a reminder, like what A means, C means, and T means, and put a sticky note on your refrigerator. So when you're because when your lids flip too and you're upset that your child's doing something, it's hard for you to think of this stuff too sometimes.
Can you discuss the most powerful elements in a playroom and what they reveal about a child?
Hmm. I think the most powerful part is just the opportunity for them to feel free and to feel like they have some control and empowerment. Because if we think about the life of children, they're getting directed a lot by adults on what to do, when to do it, how to do it. And so it doesn't leave a lot of opportunity for them to figure out their own way or how they want to be in the world or how they can problem solve on their own and be creative. And so I think that can be the most powerful part of play therapy is just giving them that freedom and opportunity to have this special safe place with someone there to be with them and acknowledge them and understand them and connect with them, and allowing them the space to kind of work through some things in their own way and in their own time and space and through play, which is, the way that they communicate. It's fun, it's safe, and it provides some distance between some hard topics because it's hard for adults to come and sit in therapy across from a stranger and talk about the deepest, darkest things that maybe you're thinking or feeling or that you have experienced in the world. And so allowing the children the opportunity to use toys to do that as a symbol of their experience can be really powerful and help provide that safety of being able to do that and revealing some vulnerability.
Yes, ma'am. Do you find the sand tray to be more effective than using Legos, or are Legos better than playing card games with children? What do you find to be the most effective?
Yeah, so I think in child-centered play therapy, we don't use any kind of like structured games or books or mechanical toys or electronics, just because they kind of have a right and wrong way to use them and they're very like structured and there's usually one way to do it. So the toys and materials we use in the playroom are very open and symbolic, and we have particular categories. So there's like real life toys, there's expressive creative toys, and then there's aggressive release toys. And they're really meant to be more projective so children can kind of use them in all the ways they would like to and make them be whatever they want them to be. Um, And then the sand tray, yeah, I think that could definitely be part of this, the child-centered room. And some kids use it in different ways than others. So like younger children might actually play out scenes with the miniatures in the sand tray. Whereas older children might just create scenes and then want to talk about them and describe them with you. And so I think both ways are very powerful. And I think what's cool about child-centered play therapy is the children get to decide how they want to utilize the materials and what works best for them. So they're really, really view them as kind of the experts in how they want to express themselves. So we don't usually come in ever with an idea of telling them what to do or this is what you're going to play with. They get to decide. So I don't know that there's really one that's better over the other than just making sure that the materials allow for expression and creativity and just kind of like openness so that they can be used in a symbolic way.
Can you give me some do's and don'ts for parents when trying to do structured play with their kids?
Yeah, so when if you want to try to incorporate some special playtime, like we call it in child-centered play therapy, you can try to set aside 20 to 30 minutes a week typically, or if you don't, if your schedule allow for that, even little bursts of like free fun and attention can be really powerful. But typically, you want to set up a little area with some toys in those different categories that I mentioned, and just sit with them for about 20 minutes a week and allow them to guide the play and try not to intervene with like, the right way or wrong way to play something or suggesting ideas or just try to let them tell you what to do. So if they're like, let's play house, okay, tell me what you want me to do. Tell
Yeah.
me, let them direct you what the role looks like because my idea of playing maybe what grandma is may not be their idea of what grandma is. So it's really just allowing the freedom for them to be in charge, in air quotes, for
Yeah.
20 minutes. So they feel like um, some freedom and it gives them time to like build that relationship.
Why do you think it's important for a child to see their world reflected in the play materials?
It's really important, definitely, to have representative materials and items in the playroom because if the child is not able to have these materials to share what they're experiencing, then that's going to inhibit kind of their communication with the play therapist, right? So
Mhm.
I give this example. I think I talked about it when we met for our training that when I was in Miami, my daughter in daycare, they would have rice beans and plantains like almost every week for lunch. But here where we live now in South Carolina, I don't think they've had that one time. So in my playroom kitchen, if I were to have that in Miami, I definitely would want rice beans and plantains in my play kitchen, where here I probably wouldn't necessarily incorporate that intentionally. But there might be other things in the community or the world around them that would be really important. Just like having multiple types of family members, different skin tones in the playroom for dolls and families, multiple families, because sometimes there's lots of different people living in the house. So you want to make sure that you have these representations for children so they can best communicate kind of what they're experiencing and what's happening in the world around them.
Thank you.
Mhm.
Is there a significant red flag that would suggest that a child might need more help than just doing play?
So you're saying like extra interventions?
Yeah, like how do you know that you're dealing with a problem that's beyond play therapy?
Yeah, so I would say if you're feeling like the play therapy is kind of like stagnant or you're not seeing the changes you would like to see, it might mean a couple things. So it might mean that a psychiatrist might maybe could need to get involved to introduce or discuss some medication management with the child if there's some symptomology related to, impulsivity like ADHD or really excessive anxious symptomology. So that might be the case. You might need to do some more work with the parents or caregivers in the home to help them, create this more supportive space because it is hard to be a parent and it's hard to parent children that have struggles. And, a lot of the things that we're trying to introduce for parents to try, they're hard and it takes a lot of practice and support. And sometimes parents are having their own struggles that they might need some support with. So, that's something else too that we're not necessarily going to be the the caregivers or parents counselors, but we do, talk with them about what they need and how we can help better support them. Because, the reality is when we do play therapy, it's often just for like an hour a week, whereas the parents are with the child a lot more hours than that, so they can make the biggest impact. And research has really shown that the more parents are involved, the better impacts and outcomes there are for children's mental health. That's definitely a piece. And then if the children are in school, that's even another layer that if we can get them on the same page and help them support the children with some of these skills or other ways that are more positive based and supportive, that's even another layer because we know they're with teachers a lot too and in the schools a lot. So if we can get everybody working together, I think that can really help to make a big impact, greater impact.
How could teachers better incorporate play into their lessons to maybe get kids to retain more from the lessons that they teach?
Yeah, I think that's a great question. And unfortunately, we know in all levels of school, unfortunately, we feel like we've cut that out a little bit because we feel like we need to pass these tests and things, right?
Yeah.
So, but the thing is, the research out there is showing that actually, if you incorporate play and movement, that your, testing scores and academics increase. So, it's kind of this I don't know if you want to call it like a catch 22, but it's like this cycle where, children are misbehaving or they're having quote unquote bad behaviors and then they get the recess taken, which is
Yeah.
probably they really need to help settle their bodies and brains a little bit more. But, play, it taps, like I said, into all those parts of the brain. And so we know that, in our memories and in our brains, they retain things more when our whole selves are engaged and we're all, attuned and we're all present in the learning. And so, and it's fun and engaging and motivating. So, I understand that we can't make everything playful, but if we could try to incorporate more play and less worksheets, I think that everyone would be happier if we could do that. And really, it's just a matter of, okay, this is the concept I'm trying to teach. Is there a way that I can make it more playful? Can I turn it into a game? Can I have centers, even in middle and high school? We don't do those kind of things as they get older, but why not? I teach college classes now, and when I bring Play-Doh in and these fun activities to teach in my class to adults, you would think that, I gave them $100 because they just think it's so, fun and they love the Play-Doh, and they're adults. So I think everybody can benefit from play. And it definitely, I think, helps everyone.
Yes, ma'am. For the practitioners who, well, for the therapists out there who may have adult clients, how could they incorporate play therapy into their sessions?
Yeah, great question. So this is also true for teens even, you can incorporate it lots of different ways. So sand tray is really powerful. And so that's one particular type of playful kind of intervention that you can use where even just rubbing your hands in the sand sometimes can feel really therapeutic and healing for clients of any age. But allowing for that symbolic representation in the sand tray can be really impactful as well, because again, it does provide some of that distance and different perspective taking when you can see things from different points of view with these symbols and miniatures. So I would say that could be definitely one way that you could incorporate play. Incorporating more like creative arts and inspired kind of things can be helpful too, such as, painting, using clay. I know there's a lot of adult coloring books out there now. So even
Yeah.
just like utilizing some of that while they're talking can help just like open or expand their mind a little bit more, their brain, because it kind of keeps their mind a little occupied so they feel more comfortable to talk and express themselves verbally. So, playful ways that way can be really helpful too, I think so. And incorporating, even some movement as far as like chair yoga to start or end your sessions with adults, or even doing it yourself for self-care. Those are all just little ways that you could maybe engage more of your senses in your body when you're working with clients of all ages.
So, how should one approach using play therapy with elderly clients? I can only imagine trying to get my grandmother to do chair yoga or anything like that. So, how should somebody approach this?
Yeah, well, I think for sure, I think we all, might be skeptical of like playing when we're older because we forget how
Yeah.
to do that and have fun. So you might want to ask them like what they find enjoyable and see how you can incorporate that. So maybe my idea of play and enjoyment isn't another person's, because even, I like to incorporate some of these things with my students as far as drawing or painting, and maybe they don't like to draw or paint. So sometimes it's kind of like doing the opposite effect that I want. It's kind of like, I don't feel comfortable and confident in my abilities to do this. So it helps me not feel safe and open, right?
Yeah.
So it is important to kind of gauge, what that would make them feel comfortable and safe and things they do enjoy, you know, as far as like wanting to incorporate that. Some things that are less, I go intimidating, I guess, are things that wouldn't require like artistic ability. So for example, like some collaging, that's a great thing to do.
Uh,
If you have lots of old magazines or know somebody, and of course, you want to have all kinds of different types of magazines available for clients, but they can cut out pictures or words, or just you can use any kind of prompt or something for them to um, process with you around. But that doesn't really require any artistic ability. So some folks are more open to things like that, or just like if they have a phone, everybody has a phone usually with a camera, taking pictures of things in their world in a moment when they felt a type of way and bringing that into the session and talking about those feelings surrounding their experience of this photo that they've taken. Those kind of things where it's not as intimidating, or even I have these cards with like these representative images on them. So for example, I might have a picture of a bunch of locks with no keys, or like a storm, or like a sunshine with a rainbow. And I just kind of lay all these cards on the table, and I prompt like, pick a card that shows how you were feeling today, and how you wish you could feel tomorrow, or
yeah.
something like that. So any prompt you can think of that you want to talk about or process. And then they just choose the images. And then it's kind of like a really powerful way for you to get insight into what they're feeling or thinking if they're not feeling comfortable to talk about it, or maybe they don't know how to talk about it, or it doesn't feel, they're kind of nervous about it. But it does provide this like way for you to get some insight, but also a springboard of talking about the image in a safer way. So those are just some examples of maybe how you could incorporate some playful or expressive things that might not be as intimidating.
Yes, ma'am. So would I consider like the Rorschach ink blot test thing? Should I consider that part of play therapy too?
I would say no. I would say that's a kind of a more structured assessment.
Okay.
But I think it's, you're kind of getting at the idea of it's a symbolic kind of thing. But yeah.
Yes, ma'am. What is one single thing that people can take away today that they can try on their own to improve their ability to listen to their child's play?
The biggest thing I could say is make some time to put down your phone and your devices and really be present, because it's really hard for children to feel valued and understood and heard if we're stuck to a screen. And it's really hard because we're modeling that for them too. So then they're going to start, valuing that screen and getting, some more time on the screen than play. And so I think that's the biggest thing. But also just taking time to acknowledge and reflect feelings, that can be a big tool to use. And just taking some time to really just delight and engage with your child one-on-one, like I said, without screens, in a way that's playful and fun. And I think that will make a big difference for a lot of people.
Yes, ma'am. Is there anything that you need to share with the audience? Any final words?
I'm trying to think if there's anything I haven't said that I want to reiterate.
I want to say thank you for coming on to the episode today. The audience is going to love this.
I hope so.
I greatly appreciate you. What do I say on the outro again? I forgot. If you enjoyed today's episode, please don't forget to like, comment, subscribe, and I'll be back with you for another one.